One of the specific syndromes you can see with metabolic syndrome is leukoariosis, which is a mouthful. Most of us were taught in medical school, internship, and residency that as folks get older, when we see atrophying of the brain and we see loss of the gray matter, that's just aging. But now we're seeing on MRIs, we're seeing leukoariosis in teenagers. So this is not normal. And if you actually go to the PubMed search engine at the National Library of Medicine and you put in the term leukoariosis, you will find that the preclinical folks, they're trying to tell folks this is a very dangerous condition. This is not normal to have your brain scarring and shrinking like this. But doctors are taught that's what happens, so they kind of blow it off. I don't. When I see leukoariosis in an MRI, I get very nervous because we've been reversing memory loss in our practice for the last 10 years. And the sooner you can get to it, the easier it is to reverse. But basically what it looks like is these are, I can't remember if these are CT scans or MRIs, but here's a little bit of it here. Leuko means white. Ariosis means rarefication. That's where the word came from. Because when they were battling on developing the terminology for ICD-10, there was no language for this. So they were going to call it ischemic paraventricular leukoencephalopathy. Well, if you can say that, you get a free drink at the bar. But then they come up with leukoariosis, and they mean the same thing. But here it's a little bit more advanced, and you can see it's around the ventricles, because it doesn't have to be around the ventricles. But you can see it here, and a little bit more here. Notice out here, it's not around the ventricles. It's actually out in the parenchyma of the brain. And that's one of the interesting things. If you look at the science today about temporal lobe seizures, they will tell you that temporal lobe seizures come from lateral temporal sclerosis, which is leukoariosis in the lateral temporal areas, because we've reversed that in folks too with the ECP. Again, these are just additional pictures where you can see how bad this can get, and whether it goes from this to this, the radiologist and the clinician will tell the clinician, and the clinician will believe it. Well, it's all just normal. They're just getting older. Don't worry about it. My advice would be worry big time about something like this, because the sooner you get to it, the easier it is to stop it and reverse it. Here's just another angle where you can see the leukoariosis plaques. And again, notice it's not near the ventricles here. So the area of the brain that is affected will determine the clinical syndrome that you see. Just like if you get small vessel disease in the kidney, you'll get high blood pressure. If you get it in the heart, you'll get diastolic heart failure. Watch the echoes you order for diastolic dysfunction, and the cardiologist will just blow it off. They shouldn't. That's a clear indicator the heart has small vessel disease and it's stiffening. If you get it in the brain, you'll either get small strokes. They're not going to be big strokes. They're going to be small strokes, lacunar infarcts, or you're going to get Alzheimer's-like dementia. Now, treatment, the way I do it, because it's a natural process and you have to educate people. So if you start with drugs and stuff like that, you're building a house on quicksand, in my opinion. You got to start with a good foundation, which is diet. And I tell people high protein, low carb diet. I can't tell you how low to go, what to do, because one of the bigger mistakes we see folks make in the spring and summer is they eat a lot of fruit, and fruit's sugar. And then they wonder why the hemoglobin A1C is not coming down in October. Well, they just spent 6 months eating fruit. Exercise, and interestingly now they're saying 6 hours a week, the exercise physiologists, and somebody finally came out and said, Mayo Clinic finally came out and said a truth, too much exercise is unhealthy. And that's true. Look at some of these long distance runners. They look like death warmed over. And then just lifestyle changes, don't smoke, don't overuse alcohol, just common sense. One rung above that is to use targeted supplements. Now, vitamin D we talked about, and we'll get into this further, but supplements that can help glycation, carnosine, there's a preparation called dioxanol, activated B1, benfotiamine, pyridoxamine, which is actually B6, methylated forms of B12 and folic acid actually unhook the sugar from the protein. They do scientific impossibility. They unglycate the protein. According to science, that's not supposed to be possible, which is why people shouldn't listen to academic scientists sometimes. And again, metformin, which is a derivative of goat's rue, the herb, it's an amazing thing. I mean, any country you go to, if you develop type 2 diabetes, the first drug the doctor is going to put you on is metformin. It has some amazing properties, but even today we don't completely fully understand how it works. But two of the properties it has that are very important here is it suppresses glucose production in the liver. It suppresses gluconeogenesis. And a lot of folks that aren't eating sugar, they're scratching their head trying to figure out, well, why is my sugar up or my hemoglobin A1C not coming down? Because you're overmaking sugar in your liver. And one of the chemicals that has been found to do that big time, high fructose corn syrup. And then carnosine, we're going to talk about a little bit more. But if you're going to use B12 and folate, use the methylated forms, the activated forms. Benfotiamine's activated B1, pyridoxine, which I was trying to get for 5 years. The Chinese have been selling it all over the world. We found one supplement company that has a product with pyridoxamine in it. We didn't know how well it works. Now we know it works like magic.
If with your therapies you improve the microvascular occlusion, you see a consequent benefit in hemodynamics. And really my question is, have you seen any improvement in shrinkage of the brain in the elderly?
No. Well, we haven't looked at that because of the cost and stuff, but we see memory loss go away. We see function improve. So don't misunderstand. When you have leukoariosis, that's a structural problem. That's scarring. What we're going after is the functional aspect of the patient. Can we improve their function? Because when we first started using ECP, just by accident, 2 patients that were, one was a matriarch, one was a patriarch of their family. They were diagnosed with Alzheimer's. And we have a monograph. My office has a monograph where we have over 300 references about this. We're not making all this chemistry and stuff up. This has been documented scientifically. Part of the problem with Alzheimer's is a language problem. Are you talking about Alzheimer's disease or are you talking about Alzheimer's syndrome? Because Alzheimer's disease, by definition, according to Louis Alzheimer, cannot occur in anybody above the age of 55. It was pre-senile dementia, sometimes called dementia precox. After 55, you called it senile dementia. But we think a very large number of folks that may have a genetic predisposition to Alzheimer's actually have microvascular disease. Because I'm kind of fascinated by the articles I found just recently that carnosine reverses amyloid. Because in my mind, see, why aren't the big pharmaceutical boys looking at this? They know that the panacea exists. This is published science. I think it's money. I don't think they can patent carnosine. I think it's that simple.